welcome to Pediatric Endocrinology Awareness Program. This is a scale awareness program about Endocrine Society of India, Pediatric Endocrinology. So now we have a guest, Dr. Sharvil Gadve from Kolhapur. He is an endocrinologist. So welcome to our program, sir. Namaste. So, sir, you know that type 1 diabetes is increasing day by day, and most of our kids are facing problems in treatment and about insulin in type 1 diabetes. Can you explain your experiences?
So, type 1 diabetes is a very specific diabetes and which is more common in children compared to adults, although it can also happen in adults. So, if some child is diagnosed to have type 1 diabetes, it is very important that the child should continue daily insulin several times a day and should not be stopping the insulin. That is very important. If the patients discontinue taking insulin, the child with type 1 diabetes can land up into problems what we call as diabetic ketoacidosis. So it's mandatory that any child diagnosed with type 1 diabetes should be continued on multiple daily insulin, although there are now other options also, but important is that they should be on insulin.
So, Sharvil sir, very nice. So I have one more question for you. So how to convince your type 1 patients to have multiple injections? How do you go about this?
Yeah, so what I prefer to tell the child and the parents of the child, it is very important that we have a good discussion with the child's parents and try to explain to them what is type 1 diabetes. So what we do is we tell them that our body has certain essential requirements. So I always give them example of water and food. So I always tell them that your child, will you consider stopping giving your child daily water to drink or food to eat? Then they say obviously no, because water and food are very much essential for life. Then I explain to them, similar is the case of insulin. Our body has an obligate requirement of insulin. And I always tell them, I have given example of water and food.
Yeah, definitely.
So it is that essential, that critical. And unfortunately, now that your child has developed type 1 diabetes, what that means that the child is unable to produce his or her own insulin. That
Yeah.
is the condition. And so they need to take insulin on a mandatory basis. That is very important.
Yeah, definitely, sir. Now, these days we are knowing about insulin pumps. It's like automatic devices attached to their stomachs or abdomen so that they can have automatic insulin delivery systems. Can you explain simply about how insulin pump works?
So now, as we said, the first thing we start is we give the child daily multiple insulins. Now, one important innovation has been there where the number of pricks given to the child can get reduced. On an average, a child with type 1 diabetes will require 4 pricks a day, 3 pricks of short acting insulin and 1 prick of long acting insulin. Now there is this option of shifting this patient to a device called insulin pump, that is known as continuous subcutaneous insulin infusion. What that pump does is that it gives a continuous dose of insulin through the pump, and the quick set of the pump, that is the attachment of the pump, that needs to be changed after 3 days. So basically the number of pricks reduce
Yeah.
from 4 pricks in a day to 1 prick in 3 days if
Yeah.
they have to change the quick set.
Yeah.
Now important innovation has happened that now there are newer quick sets which have been available where they need to change it once in 7 days.
Excellent.
So the number of pricks get reduced.
So
On top of that, the control becomes better because now there is this closed loop technology
where
which
automatically it detects the
low and the high.
low and hypoglycemia hypo. It's a fantastic technology, sir. Then I have a doubt: how much cost it will be per patient per month, or how much a basic insulin pump costs in India?
Yeah, so very important question because cost really matters. Unfortunately, presently insulin pump available is very expensive. If you go for the automated, it is called the 780G insulin pump. That costs, basic cost is 6 lakh rupees when you buy the pump, and the recurring cost per month for the accessories and the other things, that is in the tune of 12 to 14,000 per month.
Yeah.
And on top of that there will be cost of insulin and other testing and so on. So it's quite expensive.
Sir, I have a question. For this cost, is the amount of benefit the type 1 patient is going to get is truly beneficial?
Yes, it is very expensive, but needless to say, this is one technology which has really changed the life of a child with type 1 diabetes and also the parents. I see parents being always concerned of both the things, that is hypoglycemia and hyperglycemia. The automated insulin pump makes it sure that once the blood glucose starts dropping down, on its own, the pump will stop delivering insulin. Again, when the blood glucose starts rising, it will restart. So, this innovation really makes life very simple for the child and the parents, but yes, it's extremely expensive.
Excellent, Godwill sir. So the input about insulin pump is very valid. And sir, can you explain us how to convince your type 1 patients to go for insulin, when to start insulin pump in type 1 patients?
Yeah. So, when a patient is newly diagnosed with type 1 diabetes, they should be hospitalized preferably, and then they are started on multiple daily insulin. After around 2 weeks of starting multiple daily insulin, we get to know what is the total daily requirement of insulin, and probably at that time you can suggest an insulin pump. Also, patients who are taking multiple insulin for several years also, later also you can suggest, but the earliest is maybe after 2 to 3 weeks of stabilization of their episode of diabetic ketoacidosis which they presented, you can suggest them to use a pump.
Yeah, definitely, sir. Dr. Sharvil has given a wonderful news or information about the type 1 diabetes and insulin pumps. Thank you so much, sir.
Thank you.